Welcome to the lecture on the intricacies of mesothelioma, a deadly cancer primarily caused by exposure to asbestos. Throughout this comprehensive session, we will delve into the molecular pathogenesis, genetic mutations, cellular signaling pathways, immune responses, and various other factors that contribute to the development and progression of mesothelioma. You will also gain insights into the significance of BAP1 gene mutations, mesothelioma subtypes, genetic susceptibility, and immunotherapy in the management of this devastating disease. Mesothelioma is a cancer that arises from genetic mutations, abnormal cell signaling, and weakened immune responses. Mutations in genes like TP53, CDKN2A, and NF2 play a role. Dysregulation of signaling pathways also contributes. The immune system has both pro and anti-tumor effects in this cancer. Identification of these complex molecular mechanisms can help in developing targeted therapies. The BAP1 gene is important for regulating cell processes and maintaining genetic stability. Mutations in this gene are found in many mesothelioma cases and can impact cell growth and DNA repair. BAP1 mutations also have implications for prognosis and treatment strategies. Mesothelioma demonstrates considerable heterogeneity, with different histological subtypes exhibiting distinct morphological and molecular features. The epithelioid subtype, characterized by cohesive cellular nests, exhibits a more favorable prognosis compared to the sarcomatoid subtype, which is composed of spindle-shaped cells with a more aggressive behavior. The biphasic subtype comprises a mixture of both epithelioid and sarcomatoid components. Accurate identification and classification of mesothelioma subtypes are critical for prognosis determination, treatment planning, and clinical management. Moreover, novel therapeutic approaches are being explored, targeting subtype-specific molecular alterations to improve patient outcomes. While asbestos exposure is a crucial risk factor for mesothelioma development, it is increasingly evident that genetic factors also play a significant role in determining individual susceptibility. Studies have identified several genetic variations, including single nucleotide polymorphisms, SNPs, and germline mutations, that influence an individual's vulnerability to asbestos-related diseases, including mesothelioma. These genetic variations impact crucial cellular processes involved in asbestos clearance, DNA repair, inflammatory responses, and tumor suppression. Elucidating the genetic determinants of susceptibility can aid in targeted screening, risk assessment, and prevention strategies for individuals at higher risk of developing mesothelioma. Immunotherapy for mesothelioma uses the immune system to target and destroy cancer cells. Immune checkpoint inhibitors have shown benefits, while adoptive cell therapies like CAR T-cell therapy are being investigated. Challenges like tumor heterogeneity and patient selection need more attention. Accurate radiological evaluation is crucial in mesothelioma management, facilitating precise staging, treatment planning, and response assessment. Positron emission tomography computed tomography, PET-CT, offers excellent anatomical and functional information, aiding in the detection of both primary tumors and distant metastases. Magnetic resonance imaging, MRI, provides excellent soft tissue characterization and is particularly valuable in assessing chest wall, diaphragmatic, and heart involvement. Integration of advanced imaging techniques with histopathological data enhances the accuracy of diagnosis, facilitates personalized treatment strategies, and enables closer monitoring of therapeutic responses in mesothelioma patients. In addition to genetic alterations, epigenetic changes have gained recognition as key contributors to mesothelioma pathogenesis. Epigenetic modifications, including DNA methylation and histone modifications, can significantly impact gene expression profiles, leading to dysregulated cellular processes and altered tumor behavior. Aberrant DNA methylation patterns and histone modifications have been implicated in mesothelioma progression, metastasis, and therapeutic resistance. Consequently, targeting epigenetic alterations represents a potential therapeutic strategy for improving patient outcomes in mesothelioma. Biomarkers, such as mesothelin and osteopontin, show promise in diagnosing and predicting outcomes in mesothelioma patients. Other biomarkers like SMRP and fibulin-3 also aid in accurate diagnosis and treatment response prediction. Identifying these biomarkers aids in early detection and personalized treatment of this aggressive cancer. In the management of mesothelioma, surgical techniques such as pleurectomy/decortication and extrapleural pneumonectomy are utilized to remove the tumor. These procedures have specific criteria, benefits, and limitations, and a collaborative approach is crucial for successful outcomes. Despite advances in chemotherapy regimens, mesothelioma often develops resistance to cytotoxic drugs, leading to treatment failure. Several mechanisms contribute to chemoresistance in mesothelioma, including enhanced DNA repair mechanisms, increased drug efflux mediated by ATP binding cassette, ABC, transporters, alterations in drug targets, and dysregulated apoptotic pathways. Understanding the underlying mechanisms of chemoresistance is essential for designing novel therapeutic strategies and improving treatment outcomes in mesothelioma patients. Gene therapy shows promise for mesothelioma, using interventions to target cancer cells. Oncolytic viruses replicate selectively in tumors, destroying them. Gene transfer vectors deliver therapeutic genes, enabling targeted treatment. CRISPR-Cas9 allows precise genome editing. Gene therapy could revolutionize mesothelioma treatment. The future of mesothelioma treatment involves exploring new therapies such as immunotherapeutic combinations, nanomedicine, targeted therapy, and personalized medicine. These approaches aim to enhance treatment effectiveness by considering individual characteristics and targeting specific genetic alterations or pathways. Through these emerging treatment modalities, there is hope for better outcomes and improved quality of life for mesothelioma patients. Mesothelioma, a cancer caused by asbestos exposure, is complex, involving molecular mechanisms and cell signaling pathways. BAP1 gene mutations, mesothelioma subtypes, genetic susceptibility, and immunotherapy are important. Accurate radiological evaluation, epigenetic modifications, biomarkers, and surgical techniques are vital for diagnosis and treatment. Research on chemoresistance, gene therapy, and emerging treatments offer hope. Advancing our understanding can lead to better outcomes for patients.